Hi, my name is Marissa. Welcome to your Palomar Icon overview training, sponsored by Synergy Med Sales. Supplies you'll need for treatments: gloves, patient eyewear, operator eyewear, Lux lotion, ultrasound gel, 4x4 aesthetics, tongue depressors, and rubbing alcohol to clean the system. Setting up your laser. You're gonna have to make sure you have chiller fluid in your laser. This comes with the system. Inside the door here is gonna be where you're filling it up. We're just gonna open it up and pour it in, both sides. Based on what modality you're doing, select the appropriate handpiece. To connect it into the port, we're gonna take it with both hands and push down until we hear a click. Okay? And then the handpiece here will hang onto the side. And then the fiber optic will go right into the cradle. Connecting the foot pedal, the back door of the system will slide right off. Located in the top corner, you're gonna see a little place that this tubing is gonna go into. This does take a little bit of force, so we're gonna push that in. And then the tubing is going to track down, and then we'll put that door right back on. The fiber optic arm is gonna slide right down in here, and that's gonna close that into place. Plugging your laser into the power, we're just gonna slide this right into the back, and then into any 110 power outlet. After you've attached the handpiece, we're gonna turn on the system. In the back, we'll flip that switch. And the system actually does take a minute for it to turn on, so don't panic. As soon as the system turns on, it's going to retrieve the handpiece information. It will then say system on. We'll just tap on that. Passwords 1, 2, 3, 4. Now it's gonna perform a system test. Before you use each handpiece, it's gonna have to be calibrated. The monitor on your laser is gonna tell you exactly what to do. First, we're gonna take this calibration and we're gonna slide it right onto the laser. Then it's gonna ask us to put it into the holder. Once it's all set, it will ask you to calibrate. Tap that button and calibration will begin. It's gonna tell you to remove it. The system's ready for treatment. So let's talk about the settings on the laser. The laser runs with joules and milliseconds. What does that mean? Well, we have our joules and we have our milliseconds. So our joules is the amount of energy that's gonna go into the skin. What this is based on is pigmentation. The joules are attracted to the pigment. So the more pigment somebody has, the less joules you use. The less pigment, the more joules you can put in there because it's not gonna heat up as fast. Milliseconds is the distance in measurement between a crest of a laser. So when the laser beam goes into the skin, it goes down like this. Our milliseconds is the distance between the crests. So the bigger the millisecond is more distance. The smaller the millisecond is less distance. So let's talk about what that means per modality of the laser. When your patient arrives, it's important to do a patient intake form as well as a consent form. With these intake forms, it's important to have them do a Fitzpatrick typing. Your Fitzpatrick typing is going to determine your settings for all modalities of the laser. Fitzpatrick is a scale that's going to help you understand the pigment within the skin. The pigment within the skin is going to help you determine your jewel settings. On your patient intake form, you're going to look for a few contraindications. The major ones are going to be no antibiotics or photosensitive medication. They need to be off of this for 14 days before treatment. You cannot treat over tattoos with any modalities. It will burn your patient. Your patient cannot have any sort of active tan or sunburn, any history of cancer. There's a few other contraindications, but these are the major ones. Please refer to your user manual for the additional. Connecting your SkinTel system, it's a Bluetooth that connects to the laser. As soon as you power it on, we're gonna go to Tools, and then SkinTel Setup. Now we're gonna turn on that Bluetooth, and what it's gonna tell us to do is press and hold this. So now it's going to detect it, now that this is on. Confirm the sync. We're all set to go. So your SkinTel system is going to tell you what your patient's Fitzpatrick is. To use the system, we're gonna go ahead and press the gray button, and then we're gonna press and hold on our skin for 1, 2, 3, and then transmit will turn blue. Once transmit turns blue, I can go ahead and press that gray button, and it tells me what my SkinTel score is. I'm gonna press the check button, and now it accepts it. So our SkinTel reading is the melanin index, and the melanin index determines our jewels. But what determines our milliseconds is how thick the hair is we're treating. So remember, for a thicker hair, it's a bigger millisecond. For a thinner hair, it's a smaller millisecond. So look at the hair that you're treating, determine how thick it is, and then look at, so if I say my hair I'm treating is fairly thin at a 20 milliseconds, it's gonna tell me my SkinTel range, my jewels, can be anywhere from 26 to 30. If I have a thicker hair, I'm gonna bring that rate up to 80 milliseconds for a thicker hair. Now it's telling me my SkinTel, my jewels can be anywhere between 42 and 40. So I'm going to adjust that jewel based on my melanin index. Let's talk about the Max R. The Max R is for laser hair removal. We have the two settings. We have our jewels and our milliseconds. So adjusting them, our jewels, the more pigment you have, the less jewels you can put in. The less pigment, the more jewels. So we're not overheating it. And then with the milliseconds. So we talked about the milliseconds and how it's the measurement of the distance between the crests of the laser. So when we're talking about laser hair removal, if we have a large, thick hair and then a thin hair, if we take this millisecond and we hit this large hair at a smaller millisecond, so a smaller crest, we're gonna overheat that hair and we're gonna end up hurting our patient. So the larger the hair, the larger we need that millisecond, so we're not overheating it. Now with the thinner hair, we actually want a smaller millisecond because it can take more heat. There's less target there for it to heat up. So the smaller wavelength is what we want, the smaller millisecond on the smaller hair. Before you treat for laser hair removal, you're gonna wanna make sure the area has a nice clean shave. For the underarms, no deodorant. After finding out what our patient's skin type is, her Fitzpatrick, we come over to the chart. She is a Fitzpatrick 4, so I'll go down to number 4. We're gonna treat her underarms. So we'll go to line where it says underarms. And now we're gonna figure out what her joules are. So it says anywhere between 14 to 40, and our milliseconds is going to be at 100. So again, remember our milliseconds, the thicker the target, the bigger the target, the more milliseconds. The smaller the target, the less milliseconds. So let's go over to our patient and put some ultrasound gel on the area. So here comes some ultrasound gel. Sorry, it's a little chilly. I'm gonna put that ultrasound gel all the way around here. Press power. Put our settings on here. So I said 100 milliseconds. And for Michelle, it says anywhere between 14 and 40 joules. She's a little bit of a lighter skin type 4, so I'm gonna go all the way up to 30. So 30 joules, 100 milliseconds, and I'm gonna go ahead and do a little test spot. So we're gonna take that hand piece, press it onto her skin, and let her know when you're ready to fire. So I'm gonna fire the laser now. How'd that feel? Any heat? Did you feel some heat? And then what our patient actually wants to feel is like a hair being plucked out. So the hair being plucked out, that feeling is when the laser's hitting the follicle. Did you feel a hair being plucked out a little bit? Perfect. So I'm gonna stick with that, no residual heat. Here we go. And so with a 20% overlay, I'm just gonna go ahead and stamp all the way across the area. For your post-care, the patient might feel like a slight sunburn and a little itching. You want them to avoid exercising. The salt from the sweat is going to interfere with the healing. Anything that's going to heat up the area. You want to avoid sun for at least a week. Their follow-up based on their treatment area is going to vary. Anything of the body is going to be 6 to 8 weeks. Anything of the face is going to be 4 to 6 weeks. Check with your manual to see what body part has what intervals. So the other modalities on the icon are going to be the Max Y and the Max G. They both target pigmentation as well as vascularities. However, one goes a little bit deeper than the other, and therefore the Max G is going to be better for the vascularity, the Max Y for pigmentation. So let's talk about how this works. And it's exactly the same as we talked about previously with our joules and our milliseconds. So if we can recall, joules are for the pigment, milliseconds is for how large our target is. So with the Max Y and the Max G, we're gonna think about how big our target is for our millisecond, and then how dark our patient is, how much pigment's in their skin for our joules. So again, we have our pigmentation and then our vessels. So if we have a big piece of melanin on our patient, our milliseconds are going to be larger as well, right? Because we don't want to overheat that piece of pigmentation. If it's a smaller piece of pigmentation, we can go ahead and do a smaller millisecond because we're not going to overheat it because it's smaller. And then again, with our joules based on our patient's skin type, that's going to be where we're picking out the joule. So pigmented lesions on your skin, what causes this? Our pigment in our skin is a protectant from the sun, from the UV rays. So when we're in the sun and we get that suntan, our melanin in our body swells up to protect our skin, just like an umbrella would. But sometimes when we get too much sun too fast, it's gonna swell up and it gets stuck that way and doesn't go back down. And so that's what that sunspot is, our freckle. The pigmentation that stands out on our skin is the damaged melanin that didn't go back down into the melanocyte. So what the laser is actually doing is, let me draw this for you. So we have our melanocyte down here, and then here's our skin. And when we get these UV rays, this is gonna swell up and protect, okay? So then normally this melanin will shrink back down into the melanocyte. But if we get too much too fast, it gets all crazy, it gets stuck there, and it doesn't go back down into the melanocyte, and we need to get rid of this pigmentation because it's stuck, suspended in the skin. So what the laser is gonna do is, when we have our melanocyte and then the melanin coming off of it, and then it gets stuck like that, the laser is actually gonna go in, attracted to this pigment, it goes in and it actually is going to blast it off of the melanocyte and then come up to the surface of the skin. So that's what we're doing. We're gonna break it up into smaller pieces, take it off of this root, and then it's gonna come to the surface and flake off. After you've determined the Fitzpatrick of your patient, refer to your chart located in the manual. So based on their Fitzpatrick 1 through 6, we're gonna go ahead and for Doug, he's a Fitzpatrick 3 to 4. We're gonna treat his face, and we're going to choose his joules based on how much pigment is in his skin. So for the skin type 4, we have a joules of 30 to 38, and then our milliseconds choices are 40 to 30. So with his pigmentation, they are a little bit on the larger side. So because we have a larger target, we're gonna go with the larger millisecond. And with his skin color, the joules, he's right around a mid-range of a skin type 4. So I'm gonna go in that mid-range of the joules. And so that's gonna be about on a 34. So my settings for this treatment is gonna be 40 milliseconds and 34 joules. So we determined our milliseconds is gonna go all the way up to 40. And then our joules are gonna be on 34. So now we have our milliseconds 40, joules 34, we're ready to go. I'm gonna press the start button. So make sure your patient's wearing patient eyewear. Doug, I'm gonna put this on your eyes here. You wanna lift up, I'm gonna tuck this back. Is that too tight? Does it feel okay?
It's good.
All right, perfect. And then operator eyewear. Using clear ultrasound gel and a tongue depressor, I'm gonna put ultrasound gel on the patient's face. So this is gonna be a little cold, sorry. So I'm just gonna start with a little area here and do a little test spot. So ignite the laser. We're gonna use the foot pedal. So I'm just gonna go ahead in a area on the side here and just do one quick test pulse. So bear with me, Doug. I'm gonna go ahead and fire the laser. I think it turned off on me. I waited too long. There we go. All right, here we go. And it's gonna feel like a heat and like a little snap, okay? Here we go. So I just do one pulse, and I'm gonna take my eyewear up, take a look at his skin and see how it looks. Looks good to me. And now I'm gonna ask the patient, do you still feel any heat in your skin?
No.
Did you feel heat at all when it hit?
I do.
All right, but it doesn't hurt right now?
No.
Sounds good to me. If you feel heat still in the skin, you're gonna wanna take those jewels and bring them down. So that setting seems to be doing well. He doesn't feel any residual heat in his skin. What our endpoint we're looking for is to have that pigment brown up just a little bit and come to the surface. So I'm gonna go ahead, do a couple more shots and see if he's feeling okay still. So with a 20% overlay, I'm gonna go ahead and go right along his cheeks. Is it still feeling okay, Doug?
It is.
Okay. I can actually see some of the pigmented lesions starting to brown up and get a little bit darker. I like this setting and I'm gonna keep up with it. So working in this 20% overlay, I'm gonna go ahead and cover all of his skin. And I'm gonna stay out of the bearded area. Still okay? Good. Always make sure you're checking in with your patient. I'm gonna take these little goggles, I'm gonna flip that up. I'm gonna put some gel on the nose. I'm gonna show you how to do his nose. So let me go ahead and put the gel all around here. So the reason why we need gel is so the laser can couple to the skin and the light doesn't bend and cause a burn. So let me show you how to do the nose. I'm gonna go ahead and grab Doug's nose. So bear with me, Doug. I'm gonna grab your nose, pull it to the side. I'm gonna lay the laser right in there and I'm gonna fire it. And I'm just gonna go ahead with one finger, push his nose towards the laser, and then the other, press down with the laser. And then I'm gonna go to the other side. And same thing. And then pull it to the side. And then right on the bridge of the nose, I like to take my two fingers, put it around the nose, and then press that laser right in between the eyes. Perfect. I'm gonna come up onto the forehead and then move over to the other cheek. Yeah, I see those brown spots starting to lift. It looks really good. If the brown spots weren't lifting, what we could do is change those milliseconds. We could make the milliseconds a little bit smaller. That way we're targeting that target a little bit more fine-tuned. So notice I'm working in rows, 20% overlay. And we're gonna want a good amount of pressure. Press it right down onto the skin so we have good contact. That pressure actually feels pretty good for your patient because this is a cooling tip and it's gonna cool the skin down a little bit before it fires. So now that I'm done with the full coverage of his skin, what I'm gonna do is clean off the gel. And I'm gonna go around and maybe hit some of the more prominent lesions one more time to really help pop them off. So Doug, what you're gonna notice is some of these brown lesions are gonna come up to the surface like little scabs. That's the melanin releasing from your skin. So it's going to be very important for you to not pick at them. They'll fall off within 7 days. No exfoliation for 7 days. And then you're going to want to make sure you're wearing a good sunblock. You might feel a slight sunburn feeling for the next couple hours. That's completely normal. Is it feeling okay? Perfect. So I'm going to wipe this off. What I like to do is turn off the lights before I take the patient eyewear off my patient so their eyes can acclimate to the lighting. So I'm going to go ahead and turn off that light. So after the lights are off, I'm going to remove the patient eyewear. Just let them know I turned off the lights so their eyes can adjust to the lighting. And I'm going to wipe the gel off. I'm going to put some sunblock on. And follow-up for this is going to be 4 weeks. So we'll have them come back in 4 weeks for a follow-up treatment. Generally, treatments are going to be in series of 3. After a treatment, to turn off the system, we're just going to hit system off in the bottom right-hand corner. System will power off, and then we need to clean the handpiece. So to clean the handpiece, we're just going to use a 4x4, wipe the gel off, and then with a cavi wipe or another 4x4 with just regular rubbing alcohol, we're going to clean the tip of the handpiece. Now that the handpiece is clean, we can change it out for our next treatment. So to switch out your handpiece, make sure the laser is shut off and you've powered it off. We're going to press in this button on the front and then remove it from the port. With both hands, we're going to hold this, remove it from the cradle. We can now store this away and attach the next handpiece. So attaching the next handpiece, just like we did previously, we're going to go ahead and clip it in. Hang the handpiece and then the fiber optic right into the cradle. When you attach a new handpiece, you're going to have to calibrate it. The system will instruct you exactly what to do. So it's telling me to go ahead, take the handpiece, clip on that calibration, and then slide it into the holster. So the YAG is a 1064 laser. This is attracted to blood, so this is good for leg veins, as well as laser hair removal for darker skin types. So let's talk about how the YAG works. Again, we have our joules and our milliseconds. So if we're talking about the vascularity of the YAG, we're gonna look at a vein, okay? So if we have a spider vein in our patient's leg, say, and it's a little bit thicker, the same stands true. Our milliseconds will be higher for the thicker target. If that vein is thinner, so a real thin vein, our milliseconds will be shorter, okay, smaller milliseconds. And the same holds true with the joules. If our patient has darker skin, or if that vein is a little bit darker, our joules are gonna be lower. If it's lighter, the lighter skin, joules will go up. The 1064 is gonna be for dark skin hair removal and leg veins. To do leg veins, you're gonna use this little tip that goes on, and what that's gonna do, it's gonna narrow it down to a 1.5 millimeter, 3 and 6 millimeter. To do hair removal, you'll have this off at a larger millimeter. So looking at your chart for leg veins, we're gonna look and see how large the leg vein diameter is. So on our chart, we have anywhere from 0.1 all the way to a 4 millimeter. So look at that leg vein and see what size we're treating. Then we're going to adjust the laser to that according millimeter. Now, if we go all the way over to where it says jewels, again, depending on the color of our patient's skin, as well as the color of the vein, we're going to adjust more jewels for lighter skin, lighter veins, less jewels for darker. And then our pulse width is gonna be for the larger veins, larger pulse width. So then we go over to the milliseconds. For the larger veins, we're gonna need larger milliseconds. Smaller veins are gonna be for smaller milliseconds. So after you plug in your 1064 YAG, you're gonna have to calibrate this handpiece. So again, right on the monitor, it's gonna tell us what to do. So we take this calibration and we're gonna slide it right on. Press calibrate. So depending on the size of your patient's vein, we're gonna choose the spot size based on the diameter of that leg vein. So for this patient here, it's fairly small. Her leg vein here is about a 0.5 millimeter. I'm gonna go ahead and choose the 3 millimeter spot size. With that 3 millimeter spot size, we're gonna do a 300 to 350 joules and 20 to 40 milliseconds. So for this vein here, it's fairly small. I'm gonna go down all the way to 20, right? Because smaller target, smaller milliseconds. And our patient's fairly fair-skinned, so I'm gonna put that at 350 joules. So let's adjust that on the screen. So 20 milliseconds and 350 joules. Because it's going to be a smaller spot size, we need to make sure we have that plate on there. And then up on the top here, we're going to slide this to adjust it for the different millimeter size. So we have 1.5. If I click it back, it's going to change to 3 and then 6. So let me go ahead, put it back to 1.5 because that's the setting we need. And we're ready to start treating our patient. For vein removal, we're gonna use ultrasound gel. And then again, we're gonna start right at the tip of the vein and work our way down. So power on the system. It's ready. So I'm gonna take that little aiming beam, start at the edge of the vein, and I'm going to just fire it. Post-care for leg veins, you're gonna instruct your patient to not exercise for 24 hours. Circulating that blood might open up those veins. Also, recommend to them to keep their legs elevated for the next 8 hours. Follow-up is going to be in 4 weeks, and we can see if any additional treatment's needed. The 1540 comes with 2 hand pieces. We have XF and the XD. The differences are in the tip. This tip has little spikes on it. What these little spikes are gonna do, it's going to displace that surface tissue so it can travel deeper. So this is gonna be for more deeper textures. The XF is smooth. So this is gonna be for resurfacing the top layer of skin. For this patient here, we're gonna be working on some acne scars. We're gonna use the XD because they're kind of deep. So for this patient, let's go over to our chart. And we have, for that XD, working on resurfacing for acne scars, it's gonna be between 40 and 70 joules and out of 15 milliseconds. So that 15 milliseconds stays the same. And then 40 to 70, so we need to look at her skin color. And then from a scale of 1 to 6, how dark is she? She's at that 4. So we're gonna go right about in the middle of 40 and 70 joules, and I'm gonna put her about 55 joules at 15 milliseconds. I'm gonna put the patient eyewear on. You wanna go ahead and lift up for me, please? Thank you. Does that feel okay? Perfect. And so I said 15 milliseconds, and then we have 55 joules, and I'm gonna press start. So this laser is attracted to water. It's attracted to the collagen to help rebuild it. So we don't need any ultrasound gel on her skin. This is gonna be about a 50% overlap. I like to start any facial treatment right in the bottom corner here underneath the earlobe. So I'm gonna go ahead and see how it feels. So you're gonna press pretty hard because it's gonna displace some of that surface tissue. Ready? How'd it feel? A little bit of heat. So with this treatment, it kind of sneaks up on them. That heat's gonna sneak up in a couple minutes, so be wary of that. Wait a couple seconds before you continue the treatment. Does it still feel okay? All right, I'm gonna go at it, and with a 50% overlap. So I'm just working in rows, going 50% overlap. It's going down into those surface tissues, puncturing out and rebuilding. So for this treatment, you're gonna do about 3 to 5 passes, especially on the deeper. So to do the nose, we're just gonna grab a hold of it, pull it to the side, and have the tip of the laser completely flat against, and then I'm gonna fire it. And then press against and fire it again, and then go to the other side. After you've done a complete pass over the skin, your 3 to 5 times, go ahead and look it over and make sure that you haven't missed any spots. So you wanna see slight swelling of that, that pattern that you see on the tip of the laser. So you wanna see that slight swelling all over the skin. If there's any place you missed, just go ahead and fire at it again. So treating around your patient's eyes, again, the laser is attracted to water. You need to stay on top of bone in order to fire the laser. So I like to take it and then pull down on the skin, push really hard, get on top of the bone, and then fire. So I'm pulling with my finger and then taking the laser, pressing and pulling down. Perfect. Now I'll get the other side. Our patient's gonna feel a slight sunburn for about 3 hours. That should go away. If it doesn't, she can do cold compresses. Follow-up is gonna be in about a month. Powering off your system, we're gonna hit system shutdown in the bottom right-hand corner. The system will shut down. Just for safety, I like to push in the emergency stop switch. And then in the back, turn off that main power. For overnight, you're gonna wanna unplug the laser from the wall.